How do drug-resistant strains complicate bone TB treatment? Imagine fighting a battle where the enemy keeps changing its weapons. That's what happens when tuberculosis bacteria develop resistance to drugs, especially in bone infections. Bone tuberculosis, or TB that affects bones and joints, is already a tough condition to treat because the bacteria hide deep in bone tissue, making it hard for medicines to reach and work effectively. When the bacteria become resistant to standard drugs, the fight becomes even more complicated. Drug-resistant strains of tuberculosis do not respond to the usual first-line medicines like isoniazid and rifampin. This resistance means doctors have to use second-line drugs, which are often less effective and come with more side effects. For bone TB, this means longer treatment times, sometimes stretching over 18 to 24 months or more. These longer regimens include newer drugs such as bedaquiline, linezolid, and pretomanid, which are designed to tackle resistant bacteria but can also cause more adverse effects. One major challenge is that these drugs can cause serious side effects. Patients might experience nausea, nerve damage, hearing loss, liver problems, or kidney issues. Because of these risks, some patients may need to stop or change their medications, which can lead to incomplete treatment and increase the chance of the bacteria surviving and becoming even more resistant. Diagnosing drug-resistant bone TB can also be tricky. Symptoms like pain and swelling are common in many conditions, so it can take time to identify resistance. If the resistance isn't caught early, the infection can worsen, leading to deformities in the spine, nerve damage, or other serious complications. This delay makes treatment harder and increases the risk of permanent damage. Sometimes surgery is needed to remove infected tissue or stabilize the spine. But if the bacteria are resistant, the infection might persist even after surgery, making recovery more difficult. Persistent infection can cause ongoing pain and disability, and in some cases, it can lead to treatment failure or even death. Because of these challenges, managing drug-resistant bone TB requires a team of specialists. Doctors need to carefully choose the right drugs based on susceptibility testing, monitor patients closely for side effects, and often coordinate with surgeons and rehabilitation experts. Early diagnosis and strict adherence to the treatment plan are crucial for improving the chances of a successful outcome. From the perspective of tuberculosis itself, drug resistance is a clever adaptation that allows the bacteria to survive despite medical efforts to eliminate them. This resistance makes the fight against bone TB more complex, requiring patience, precision, and often more aggressive treatment. However, ongoing advances in medication and care strategies continue to improve the outlook for patients facing resistant strains. Always remember, anyone with suspected bone TB should consult healthcare professionals for personalized diagnosis and treatment options.